2, 1.
Pat Petrie, thank you very much for being here today in Staffordshire. I would like to start our interview with asking you, what's your professional background? Can you tell us more about your career?
I suppose that my professional background has always been something to do with education and therefore with people. So I started off working in the East End of London in what in those days were slum conditions, and I had a youth club there. And slightly later I qualified as a drama teacher and worked with young offenders, and I also worked with young people with emotional and social difficulties, behavioural difficulties. And after that, because I wanted to know more, I wanted to understand better how to work and guiding principles and theories and so on. I went and did a master's at the Institute of Education, and after that I got a job there researching, first of all, daycare, and I quickly went into out-of-school care services and play and so on, which entailed quite a lot of work in contact with Europe. And I started a European network in that area of work. And through those interests, somebody at the Department of Health knew about them, and she herself was really keen to improve, particularly residential care in this country, and she'd heard a bit about social pedagogy, and she knew that I was interested in pedagogy, although not very well informed, and she said, would you start to research it, find out what is social pedagogy, and about residential care in different European countries. So I think it was 1999 that we started that work, and a programme of work about services for children and families in Europe, and the role of the social pedagogue and the training of social pedagogues, policy towards social pedagogy, were all part of that research programme that went on through into, well, the last thing that I think we did in research terms was the residential pilot scheme that we did for the Department of Education. That was about 5 or 6 years ago it ended. Since then I've done some work in looking at social pedagogy and the arts in European countries and in this country, including an evaluation of Sing Up, which was a national programme of singing activities for looked after children. So I'm going back to my performing roots, as it were, in drama in that way.
So you go full circle.
Yes, yes.
How would you, in your own words, describe social pedagogy?
Well, a lot of people ask that question, and one way of talking about it would be to say that it's what social pedagogues do. In European countries, many of them, social pedagogues are the main workforce for a whole range of services working with children, with families, and with disabled people, with frail elderly people, people with mental health difficulties. So people who work across a range of different practice and policy fields. But what is the essence of the work that they do? I think one of the basic characteristics of social pedagogy is that it's about working with the whole person, seeing them as a whole, as somebody with thoughts, with feelings, with physical being, as social beings. And the pedagogues recognising that they themselves also are people with thoughts, feelings, and a physical presence in the world. So it's not compartmentalising the work in a way that some professions find it necessary to do. So a medical profession would be perhaps more interested in the physical, or a teacher could be more interested in the cognitive aspects of the human being. Or therapists would perhaps concentrate on feelings. But the social pedagogue considers that all those aspects of being a human are important and works with the whole human being. So it's a holistic approach. It's also an approach that's based on the relationship between the two people, between the social pedagogue and the other person. And key to that is that it's a relationship of respect. A respect for another human being. Yes, so social pedagogues work in a holistic way, working with the whole human being. And they work on the basis of respect for and value of the other person. That they are equally human and equally have their own perspective on life. And that in their work, they walk alongside other people rather than direct other people. They accompany them on their journey, offering support, encouragement, challenge sometimes. But it's not with a preordained or pre-envisioned goal in mind. That's just some of what it is to be a social pedagogue.
What do you think brings social pedagogy to the UK?
Well, I think what brought it to the UK originally was total dissatisfaction with some of our own services for children and for looked after children in particular, and the thought that there must be a better way. And the civil servant who commissioned the work, Helen Jones in fact, thought that she had seen that social pedagogy in other countries was really a valuable approach. And that's why she commissioned the research and has continued to support the approach since.
What do you think? What kind of difference can social pedagogy make here?
Well, there have been several evaluations of social pedagogy in practice, and an overview of those evaluations finds that wherever it's been, the implementation of social pedagogy has been attempted, there have been some results which are remarkably similar from one evaluation to the next, and very often it's about people being able to cooperate, say social workers and foster carers being better able to cooperate because they may have shared training together, they have a common language and a common understanding based in the same sorts of values. It develops confidence, professional confidence. It means that children have more interesting activities in their lives very often. There's a whole range of benefits. Something that's been quite remarkable is that some local authorities, and I think they've gone public on this, such as Derbyshire and Edinburgh, have found that there are actual cost savings in adopting social pedagogy in their care services, in their foster and residential services. Because people who've been supported through social pedagogy and who are themselves taking on some of the concepts, the ideas, the ways of working, are better able to support placements. And the more stable placements are, that obviously cost savings all round, because meetings about placement disruptions cost money, they cost social work time, they cause distress to a range of people, not least to children, but also to their carers very often. But this finding that there actually are financial costs saved has been important in moving some local authorities forward in this area.
Do you think that social pedagogy works with health and safety regulations?
I think it must work with health and safety regulations, but it appears to me that health and safety regulations are seen and interpreted differently between different local authorities. And there are also myths about what are health and safety regulations and what they lay down and what they don't. So obviously anybody working in any setting whatsoever frequently has in mind what are the risks involved in this activity. Social risks, physical risks, whatever. But alongside risks attached to any activity, there are benefits. And the person who's working in a social pedagogic way will first of all make some sort of assessment of risk, which may be an implicit assessment. They may think about how necessary is it to encourage this activity in a young person, which some people might see as dangerous, such as riding a bike without a helmet or climbing a tree. They're aware of what the risks are, they're aware of the context, and the risks are different according to the child and the context. So a rather, shall I say, a very adventurous young person who doesn't take care may present a greater risk than a rather cautious person, although a cautious person may have their own level of risks attached to climbing a tree. They get scared and get stuck.
If we look at the future, where do you see social pedagogy, let's say, 20 years from now?
Well, I hope it'll be an established career in this country with a recognised qualification framework, with a professional organisation and national occupational standards. So I hope that's what will be achieved at a structural level. But basically I hope that children and all the people who work with them will benefit from that. That there'll be gain in esteem, self-esteem among children's workers, but especially for children and young people themselves.
Pat Petrie, thank you very much for coming here today to Staffordshire, attending our taste today and talking with me. And I hope we see you again here soon.
Thank you. I'm always pleased to come to Staffordshire. Thank you, Simon.